Hi guys, my name's Rob from Elite Personal Training in Hong Kong. Welcome back to the second video in the low back pain series, which today will be based upon movement in your daily lives. As movement is very important and we don't want to be stuck in a chair or in a bed or on the sofa or what like, it's good to know how to move to negate something that will flare up some back pain. So today I'll be bringing you a few different options regarding moving at home, picking up things, moving around, brushing your teeth, getting out of bed and things like this, in which a way you can move with having a nice strong core and a brace so you won't exacerbate issues and make things worse for yourself. And if you haven't seen the first video, I would strongly recommend you check that out, as it's all based upon having a nice straight core and a good straight spine. I don't mean a completely straight spine, as you need your natural curves, but a nice brace position, which will help you out a lot. And this whole set of movement mini clips is based on that first video of understanding your brace position and then hip hinging so you don't put any flexion or excessive extension through the back and make things a bit worse. So please practice that first of all, and then through these clips, the movements I will show you, practice these as much as you can to become comfortable with them and internalize them so they become natural and part of your everyday life. Because it's the small things, those everyday little movement things that all add up and end up either causing greatness or despair and pain. So please practice good movement whenever possible. So please check these out. If you should have any questions, please contact us and we'll get back to you as soon as possible. Otherwise, enjoy. Thank you again and practice every day. Move well. I'm just going to show you, an important thing, which is getting out of bed every day. And if you don't get out of bed, you're not going to get a lot done, that's for sure, except a lot of sleeping and relaxing, of course. So, getting out of bed sounds ridiculous, but it can even start the day in a negative way, which is never a good thing. You always want to start it off on a good foot and a good back. So here's a little a method to help you get out of bed slightly easier or more pain-free. So basically, as you're lying in your bed in a situation, obviously I haven't got a bad back so I can move around a little bit, but from a situation when you're in bed, you're lying there, you wake up, time to get up. I would like to shift myself over to the edge near the edge of the bed. Obviously, imagine taking the sheets off. And from here, I want to put this arm next to me underneath. And at the same time, with my legs up, I'm going to tighten the core, firstly, so I don't rotate my body, say my lower spine, on its own without the top of the body. I want to bring this down and then rotate as one solid, imagine I'm kind of made of iron, one solid unit. So from this position, near the edge of the bed, pull this in, legs up. I want to keep core on and roll to the side as one solid unit. So I'm not twisting and rotating the spine, if that could cause injury or pain. And from this position, I'm going to use this hand on top and this hand underneath slightly to help me with the legs coming down. Keep this tight. I'm going to push up and then come into this position here, which avoids, I'm a bit robotic of course, but it avoids too much twisting and flexing. So I'm just going down, stiff, into this position, legs up, core on, and in rewind I'm rolling down. So I'm very robotic, but sometimes you want to start the day just because in the morning you've been stuck in bed, almost flat to a degree, and you could be a bit tight and stiffer. And the way you start the morning is very important, especially with movement. You want to start it easily and gradually and in a good way to drill in that good, muscle memory and nice way of moving. So yeah, this is important to remember. Be stiff and solid. Don't let the hips move on their own when you get out of bed. Move as one, almost like a robot kind of thing to get out of bed. And then use your arm to push up so you're not bending by the side laterally. I'm moving up as one solid piece, and then to get off the bed, because I'm in a kind of seated position, depending if you're a low bed or what have you, I will tighten the position, bracing, spread the floor slightly, stand up, use the bum to come through, so I get that hip hinge and a nice straight position here. Okay, I hope that's useful, and I'll give you another one in a second. Okay guys, so for the next one, you've gotten out of bed, all is well, and let's say you want to brush your teeth, next thing being. So I'm taking you into the bathroom literally, and I have a toothbrush to be extra realistic about it. So you've been all good, you're nice and stiff, you've got out of bed, you've walked to the bathroom, got your toothbrush, all being well, and then brushing your teeth, good old easy regular stuff. Except for when we usually brush our teeth, I know I'm sometimes a bit lazy too, we may just bend over and spit out the toothpaste. I hope you don't swallow it, by the way. You should bend over and spit it out, but we'll usually do this without even thinking about our back. And this is definitely a trouble if you have a low back pain or whatever, and flexing is just going to make things worse. So, the same thing as I've kind of said before with the bracing and moving, and this is the main idea, having that steel column the back. So I've been brushing my teeth, and then to spit out, rather than do this and flex over, which is coming from the spine, I want to, again, don't think about all those points as much, otherwise it will drive you nuts to a degree, just ingrain this pattern. And I want you to kind of just bend from the hip will go back and down, and I'll spit out, go down. You can even hold your leg as an extra support and go down and spit forwards, and then use the bum to squeeze and come through. So I won't bend the back at all. I'll stay stiff and straight, spit it out, come back up again, carry on as necessary, and that'll be safe for splashing your face with water. You'll bend over. If your back's okay in this position, with no leaning, you can splash your face and stay here, and then come up to the standing position. And this will keep you that, give you that straight line, and help you brush your teeth and splash your face. This time, getting off the toilet. I'm not going to demonstrate this on my toilet because that's just getting a bit too real for my liking in the loo. But I'll demonstrate the second best thing, which is getting off a chair, which could be a similar height, to be honest with you. And you know, getting on and off the toilet is essential. Otherwise, we'll be stuck there, and it's not a good place to work or be stationary for too long. So, first of all, I've gone to pretend this is the toilet. I've gone into the toilet, into the bathroom, and then to sit back on the toilet, we don't want to go right up to it, necessarily. We want to be just in front of it, and we want to have our bum go down in a 45-degree angle with the same bracing we've gone through before, that good posture, good position, tighten the bum, feet just past shoulder width. You know, self-counterbalance your arms this way. I'm going to lean back, using the bum, and I'll be here, and I'll come up into this position. So I haven't changed the position of my spine at all. I've kept the brace on, the same deal as I talked about earlier on. That's key. And getting off, you can lean slightly forwards, open the legs to give your hips room to come through, and then grip the floor with your feet. You can squeeze the bum, tighten the core, head back, use the hands to kind of help get you going forwards. You're going to go forwards, squeeze, and then squeeze the bum, stand up. That gets you into the upright position, and without me doing this to stand up, which you can see is flexing my back, which in a really healthy back situation is not such a big deal, but over time, and if you have some pain, it's not going to do you any favours. So, second tip, on and off the toilet or the chair, a seated position, basically. That's the main thing. Getting up from sitting down and sitting down from standing up, and that should help you in your day. Hey, so now I'm going to go through the getting up, standing up, to getting down to the floor, and then back up again, because this is something we want to be able to do, and we should do. And should we get down, we don't want to be stuck down there, we want to get up again, and of course in a painless way. So I'll show you this little way to help you, and I would advise you practice it when you do it. Go through all of these a few times at least to get it into your memory bank and muscle memory and your way of moving in daily life. That's the key here. So in a standing position, I want to get down to the floor here. So I'm going to lunge out in front, but all the time having this straight brace spine that I've been talking about. Keeping this brace on, I'm going to come down to this position here. I'm with a train track, not too narrow because you'll fall over. So a train track position, a nice width, so you have a good stability. And if you're elderly or uncertain in your balance, or slightly overweight or have knee issues, just take heed to be cautious and don't overexert yourself or push yourself or have an injury. So really listen to your body and don't push yourself too much. But if you're okay with lunging, doing such exercise, this is a good way to get up and down without any pain. So from this lunge, we go down, brace core, set the foot back, shoulder position, shoulder width. From here, the bum goes back, keeping the brace. I come out forwards, now in all four position, and then I'm going to put one leg back and drop the elbow down whilst keeping a neutral spine. I don't let myself twist and bend. Everything's tight. Come down into this position, gently roll down and roll over, keeping the core tight the whole time. And then I'm on the floor, which is where we want to get to. And then to come back is the reverse. I pull up the leg, have this hand down, brace the core, so I move as one unit. I come over, I push up into this position in all fours, and then sit the bum back, get into this position, so you can see my line is straight. And from here, the hip comes through, up, and make sure you have good balance, keep the core tight, step up into this position, up, and that's finished your up, down, and up again. Hey guys, so now we're going to do another example of moving in everyday life. You come back from shopping, you've got your shopping, here's some I prepared earlier, and you know, it's some heavy water bottles. I haven't got any heavy water bottles because I have a good filter here, but yeah, you've got some heavy water bottles or something of the like that weighs quite a bit, and you've got to bend down and put them into, say, an overhead cupboard, as I'm going to kind of demonstrate here. So from when you have your bag here of shopping, you're gonna, when you go down, same deal always, as I keep banging on about, is bending down with that hinge, hip hinge, and from here we'll use our arms to come down and help us brace, rather than just bending over like this, as most people do when they're getting stuff out. They'll be getting things out and standing up and popping them out of the way, but we're going to do it more intelligently and with more efficiency and more back-saving care. So when we get down into this position, put them down carefully, of course. Then we're going to lean forward with the legs. And if you need to go lower, you can use the other arm to help yourself balance. So you still keep that neutral spine, the arms here to give you support, and then here I use the bum to pull up, stand up straight with my, pretend it's a heavy water bottle or the likes, and I'm going to bend and put it up above the shelf. But when we put things up, don't arch the back. Many people arch, sometimes they're missing range of motion overhead, but don't arch the back. Keep the core tight and the bum tight, and just reach whilst keeping your ribs locked down to your pelvis, so you're not extending or thrusting the ribs forward here, which will put stress in the lower spine in this direction. So make sure, and to get things out, similarly, tighten it, bring it down, come down, hip hinge, bum goes back, support yourself. You go to your knee, you're down to here, tighten the bum, core is on, you're good to go. Okay, so this next little demo for movement and keeping your back happy and safe is with something as simple, really, as just sitting down at home to relax and watch a movie, or just kick back and unwind for half an hour, or read, or whatever you like to do on your sofa if you have one. So this is going to be a little tip how to do that, because most people, even including myself before I was even thinking about it, would sit on the sofa just like so and kick back, which is, it's not weird, is it, to be honest with you? But my back rounds into that gap there, as these are not ergonomically kind of made for that sense, so we usually sit like that. So to avoid that, because if you did that for 2 hours watching a movie, and then you got up, which would probably be like this too, round, round, round spine, and then you get up and go, oh, my back isn't feeling too good. So to get around that, I would advise having a cushion of some sorts and putting it into the base of the sofa, and then pushing your bum right up to it, and then having a support for that lower back area. And if you have two cushions, which is good, I'd have one behind your head and prop it up so you can have a neutral spine, which is very comfortable, by the way, and you can relax completely, and you can move the one in the bottom to get that best fit So you can really, really relax. And if you stay here for a couple of hours, your spine's in a nice natural position, and it won't be being pulled on the ligaments between the vertebrae, which could lead to laxity, which could lead to, you know, the nerves being squashed a bit more and more pain consequently. Another thing I will recommend is one of these. I got this given to me, which is very kind. It's a Lumb Air Plus low back support or a neck support. You can take it to work, on the airplane, or I even use it at home. It's very good. You can pump this up to suit, and it expands, and it gets filled up with air, and you can let out the air with this little thing here. I even use this when I watch a movie, and I would pop it behind my back with where the cushion is, right behind my belly button, and I would get it into a comfortable position, get myself all, you know, settled, and then I would get into that position which I find comfortable, have that support for my back. I would lie back, completely relax, but my body, I were to watch television or a movie or what have you, I'll be in a completely neutral spine, pretty much, and I won't be putting stress on my back, so it really helps. And then getting up, if you get up in this position, tighten the core, lean forwards, and come up to that straight position. And the same thing, getting to the edge of the sofa, you can support yourself a little bit, keep a nice straight spine, tighten the bum, core, hip hinge, stand up, and that should help you. And that's sitting down at in a desk as well at work. You can use one of these and pop it behind your back so you don't slouch in a desk. This is very important because 8 hours, almost like per day, seated in a flex position is horrendous for your back over time. So get one of these or something similar, have the idea to pop it behind your back, have a support at home and at work if you have a desk-based job, and this will alleviate a lot of stress off your back and make you feel a lot better. Okay, so that's a wrap today for these movement issues, for simple things, getting out of bed, toothbrushing, up and down off the floor, putting things away in the cupboard, heavy items from shopping, and sitting down at a chair or at work, at a desk, popping one of these behind your back, having support, having head support too, so a nice position or whatever angle I choose to recline at, and that will help you tremendously in your daily life. I hope this second video has been useful to you. If you need any more information, feel free to contact us, and I will bring you the third video soon regarding some strengthening to get your core braced and tight and ready for daily life in whatever you should do. Thank you very much for your time.